Can you have a Medicare Supplement plan and a Medicare Advantage plan at the same time? Wow, that is a really, really great question. So when you sign up for Medicare, it's so confusing because there is so much information out there. There is so much information that people are confused about their choices. Medicare is health insurance for people 65 and over, and for some folks under age 65. The problem with straight up Medicare is it just doesn't give you enough coverage all by itself. Okay, there are a lot of exposures, and basically Medicare is paying 80% of the bill, and you're on the hook for 20%. 20% of $100,000 knee surgery, heart surgery is $20,000. That is way too big of an exposure to just have nothing in place. So you have two paths. You're either going to sign up for a Medicare Supplement plan, also called a Medigap plan or secondary insurance, or you're going to have a Medicare Advantage plan. Today I'm going to talk about Medicare Supplement plans, Medicare Advantage plans, and we're going to talk about why you can't have them both at the same time. I'm going to give you an example of my best friend's mom, Betty, Mom Keller, and she had both, and it really messed everything up. So stay tuned. We're going to break this all down for you, why you can't have Medicare Supplement and Medicare Advantage at the same time. So let's get straight to the point. Medicare Supplements and Medicare Advantage plans don't go together. I talked to a person the other day and she said, I'm going to have a Medicare Advantage plan and then I'm going to get one of those supplement plans to pay what the Medicare Advantage plan doesn't pay. Clearly, this lady was a little confused, and it was my job to explain that to her. So I'm going to explain it to you, okay? So Medicare Supplement plans, again, they're designed to supplement, fill in the gaps, pay the bill second. So when you go to the doctor, when you have a medical issue, Medicare is paying the bill first, and then it crosses right over for the supplement plan to supplement or fill in the gaps. So it's on easy. You know, you can go to any doctor, no networks referrals. It's a really easy way to have your Medicare, but it could be a little bit expensive. So you have to pay for that. You do have to pick up a prescription drug plan with that Medicare Supplement plan. And if you want some extras like dental and eyeglasses, you're going to add those there too. Medicare Advantage, on the other hand, is a totally different way to have your Medicare. And this model, Medicare Advantage, is what we're kind of most familiar with. Instead of Medicare managing your care, when you choose the Medicare Advantage plan, all your care goes through that Advantage plan. So you're still signed up for Medicare A and B, you still have to pay for your Medicare Part B premium, but instead of the bills going to Medicare to pay first and the supplement to pay second, the Medicare Advantage plan is managing your care. The Advantage plan is an HMO or a PPO, and you give the doctor your Medicare Advantage card. A lot of companies sell Medicare Advantage plan, companies with names that you know, okay? And with a Medicare Advantage plan, you have co-pays, you have co-insurances, you have out-of-pocket maximums. So let me give you an example. You go to the doctor, you give them your card. Not every doctor takes every plan, okay? Remember that with the Medicare Advantage plan, that is a geographically based plan based on where you live. So when you have a Medicare Advantage plan, you give the doctor your card and they tell you what the copay is. It might be $5 for your primary doctor, $50 for a specialist. You need medical tests, CAT scans, MRIs, blood work. You need authorizations with the Medicare Advantage plan. So you got to get approved for that MRI. It might cost you $300, okay? That's just a basic example. A lot of times there are about 60 different Advantage plans or Medicare Advantage plans in each area. And so it depends on where you live. So the $50 for your specialist, the $300 for your MRI is simply an example. So don't take that verbatim. But you understand, when you have a Medicare Advantage plan, you're choosing that Advantage plan to manage your care, and then you have a copay, or you're paying a percentage of the cost. In this type of a plan, if you're hospitalized, you're paying about $400 a day, or you may pay $1,000 per stay. You're paying as you go. If you get something like cancer and you have to go for radiation or chemotherapy, typically you're going to pay 20% of that cost. So you're just paying as you use the plan. The Advantage plans typically do not have a monthly cost on top of Medicare, unlike the supplement plan that does. So some people are attracted to the Advantage plan because they want to save on the premium, not realizing that they're paying as they use the plan. So an Advantage plan has to have an out-of-pocket maximum, and sometimes that could be at $10,000, it could be $12,000. So if you get cancer with a Medicare Advantage plan, you are on the hook for that 20% up to $10,000, which is a lot of money, okay? So let's go back to our original question. Can you have a Medicare supplement plan with a Medicare Advantage plan? And the answer is no, okay? If you think about it, the reason is because a Medicare supplement plan is designed to pay the bill second to Medicare, whereas a Medicare Advantage plan is taking the place of original Medicare and managing your care. So I said I was going to give you an example of my best friend's mom, Mom Betty. And Mom Betty was 90 years old. She signed herself up for a Medicare supplement plan after she needed some eye surgery. She was in the state of New York, so she had a guarantee issue. So she was able to get that plan without medical underwriting. If you want to know more about underwriting, we have other videos that can go over that. But in this particular example, Mom Betty had a Medicare supplement plan, and her eye coverage, her eye surgery was all covered. She was thrilled. So she didn't let go of that Medicare supplement plan, but then she was watching TV, she was getting solicitations during the annual enrollment period, and she enrolled herself in a Medicare Advantage plan. Well, guess what? You're not allowed to enroll in a Medicare Advantage plan and have a Medicare supplement plan. When you sign up for a Medicare Advantage plan, all your care goes there, and it can't go second to that Medicare supplement plan. So unfortunately for my friend's mom, she had a stroke, she went into a nursing facility, and she had this Medicare supplement plan in place that she was paying for that would have given her extra coverage, but she couldn't use it because she signed herself up to that Medicare Advantage plan, and they were managing all her care. So she was paying over $200 a month for this Medicare supplement plan for about 10 years. Oh my goodness. Think about how much money she spent that she really didn't have. And then when she went into that skilled nursing facility, everything had to be approved. It was just a nightmare. And when my friend called me up, I said, I can't fix it. I can't. Unfortunately, she did pass away. We were able to cancel that Medicare supplement plan to save her a little bit of money, but it really mucked everything up. So the message here is no, no, no. You cannot have a Medicare supplement plan with a Medicare Advantage plan. They are two entirely different options. All right, so if you found this information useful, if you're looking for more information on Medicare, go ahead and click on some of the other videos in our series. Can I change my Medicare supplement plan at any time? We are offering a free gift. We're offering a free report that you can get that answers all your questions on Medicare. So it's a really great resource for anybody who's looking for just a little bit more on Medicare.